This is in your materials, so I won't go through this, but these are the different plan levels that I talked about in terms of gold, silver, and bronze, with the varying cost sharing and premium amounts. And if you want me to go back to that, I certainly would welcome it later if we have any questions. There's an awful lot of help out there, so including us at Maine Community Health Options, and our toll-free line came off the, oh, here it is, it's at the bottom there, but it'll be on the last slide as well. But it's 1-855-MCHO for me. But in addition to our excellent our member service associates, we have, of course, the navigators. You've got certified application counselors, and I know that York Hospital has some of those, as well as some toll-free lines at Consumers for Affordable Health Care, and of course brokers and agents, producers, insurance producers, also great sources of information. So the key dates to remember are that by December 15th, that's the last date for enrollment for coverage to be effective on January 1st. And March 31st, open enrollment closes. There's a lot of discussion about, in order to comply with the individual mandate, effectively right now, one would have to be enrolled by February 15th. But that may be pushed off. We have yet to see what's going to happen with those dates, depending on the functionality of the existing federal site. But no matter what's going on there, I want you to know and be assured that our website is working wonderfully well. And you can come to maineoptions.org and get an awful lot of information. And certainly give us a call. And people are getting through the marketplace either by phone. Some people are using paper applications, and we do have paper applications here if people want to take advantage of our presence and ask us questions following this seminar. And we also have a sign-up sheet. So if you want information from us as we move through the rest of this year and into next, by all means, sign up to be part of our distribution list. So I am very pleased to move into our closing, which is to focus on just some key takeaways of why MCHO is different. Aside from being new, we are focused on the right level of care, really focused on preventive services, not preventing your access, but getting you access to the right level of care, the right time, at the right place. And that means management of chronic diseases and encouraging people who have conditions to take advantage of this unique opportunity to get coverage and to avail themselves of our benefit designs. And members have a voice. I mentioned at the beginning that we're member-led. We don't have any members yet, but we have a board that is intent on this transition. So we will have elections a year from now amongst our members, and more than half of our board has to be made up of the members of our plan. And all of our members of majority age will have the chance to vote for our board of directors. We are transparent, and I'll mention nonprofit again, so that every dollar that we bring in as a premium dollar is going to benefit the members in terms of paying those claims and supporting our administration. And then, and how those dollars are spent is going to be governed by that board of directors, which is member elected. We're really proud about our provider network. We've been in the field working to develop this from very early on. A lot of the credit goes to Rob Hillman in the back of the room and his great team. But we have just as you probably know, Maine is home to just a remarkable array of deeply caring providers, and we're proud to be working in partnership with them. And then we have high-quality Maine-based member care. So again, very pleased to be by Maine, of Maine, for Maine, stationed in Lewiston, and ready and able to take your call and support your needs. So with that, I really thank you for your attention and invite your questions. Let's have a good discussion. Yes, ma'am.
Lots of questions, but I'll try to keep it short. So I have catastrophic coverage, the $15,000 deductible with Anthem, $345 a month, which I cannot afford, and I would like to move to the Maine Community Options. But I want to know how safe it is to segue. I don't want any gaps in my coverage. My only asset is my house. I would not want to lose it if there were a gap in the coverage. And so I'm hoping there's a guarantee that you will be there if I move away from the coverage I have now. Second part, how exactly is income determined as regards to your words, getting a break on the cost? Online, I think I understood that it is the modified adjusted gross income, which would be line 21 on 1040A or line 37 on 1040. Is that correct? And last of all, when I called, I'm sorry, the list of providers in my area,
Yeah.
I found that none of them, in fact, were taking new patients. So that could be a real problem. Thank you very much.
Sure. Good questions. I'll start at the top. In terms of our being there, well, one, regardless of any switch, it's important for everyone to know that there's no longer any pre-existing condition exclusion. So there shouldn't be any kind of gap in coverage if you switch. So that's a protection for everybody, no matter what coverage they're getting. So that's an important benefit of the Affordable Care Act. In terms of our being around, we've been very prudent with our use of the federal financing, and we have significant solvency or reserves that are required, and we're scrutinized by the Bureau of Insurance. And in fact, the federal government is holding us to a higher standard than what the state requires to ensure that we're solvent and here for the long haul. So you can be rest assured that we're not only going to be around through into 2015 and 16, but for years to come. The part in terms of providers having open panels, that is something that we are monitoring and aware of, and I guess we continue to encourage, and we're building out a statewide network. We have, as mentioned, we have I think about 90% of all the providers in the state, and continue to contract with providers. But I guess I would turn to Rob, and I don't know if there's anything more there in terms of open panels.
Well, so it can be an issue. And so as Kevin said, actually, in terms of primary care providers, which is the most important piece, because our plan will attempt to link you with a primary care provider. We'll actually ask you to choose one, and if you don't, we'll actually assign you one. So what we'll attempt to do is open a dialogue. So if you actually have a provider that you're seeing, you're assigned with, and typically we'll have already established a contract with them, you can keep that relationship. You just basically, you just notify us of your PCP relationship and we'll code that. But if you're having a hard time finding in your local area an open panel PCP, we would like to hear that, and then we'll work with you on your behalf to try and see if we can find an alternative that's close by within a practice. If it's associated with York, for example, we'll work with York Hospital to try to find you an open panel PCP. And we might even try to open a dialogue with the provider themselves if you really want to see. There are no guarantees with this. When providers do ratchet down their panels and close their panels, it's often because they are truly full. So I don't have an easy answer with you other than we'll do our best to at least put in front of you the open panel options, work with you to show you where those are, and then if you really want somebody that's closed panel, we'd be as happy to assist with the dialogue to get that, to get you into that practice.
Did I address all of your questions?
No, the income piece. Is it
Oh,
based
right.
on adjusted gross?
It is,
income?
right, it is based on it. Essentially AGI with a couple of tweaks on that, yeah.
Okay, thank you very much.
Thank you.
And as I hand the microphone to the next person, I will say that York Hospital is recruiting new physicians to join our practices in South Berwick. We have a new one here in York, and we have others for internal medicine and other practices too.
So looking at your list of the incomes,
Yes.
because the state of Maine didn't go along with adding, anything under that 11,004. So if your adjusted gross income is less than 11,400, you don't qualify for anything?
There's no subsidy available.
So those are the people that will not, and they're also in the state of Maine. Correct me if you let me know. If you're right now in that group that doesn't have children, you're under 65, over 26, and you're on Durago or something, as of 2014, that's not going to exist. Is that true?
That's right.
So if you make, like, I make over $15,000, but after adjusted income, I was blind, I had to pay out of pocket for transplant. So I'll get no subsidy because I live in the state of Maine.
Right, so there are many people who are falling into this gap. Now, my understanding is how you file your tax return and whether you take advantage of all the deductions or not is your determination. I mean, you don't necessarily have to take all the deductions. Now, I'm no tax preparer.
But you don't
So-
qualify for any deductions if what you're saying is your adjusted
Right.
income falls below 849,
Right,
you don't qualify for anything.
right.
So do you
right.
offer us anything?
No, so
No.
the
No, just for all of us. because
Right, right.
now,
What I was
there are
trying
a
to
number
say,
of us asking
what I was
that.
trying to say is, I think it's worth working with one's tax preparer or working to look at whether you take all the deductions on your income tax or
I think
not.
most of us, and I know it's not your problem, but
Mm.
just this is,
Mhm.
you're just starting these. People who fall in that group, we don't have anything but standard deductions.
Right,
What
right,
extra
right.
deductions
No,
are
I'm
there?
just,
I'm
I
just curious.
I understand. There's a heartbreaking story of a farmer in Monmouth that I just read about today who, he makes $8,800 a year. He's 62 years old, and he's going to get nothing because there's no Medicaid expansion in the state. This is meant to be paired with Medicaid expansion. That was the way it was designed. So without that, there are people falling in this gap, and
That's a straight gross income for a person?
No, that's adjusted.
That's the adjusted.
We need to go to the governor's manual.
That's
I
the
followed that.
modified
That's the
adjusted
number
gross
we have
income.
there is the max.
That's the adjusted income, that does not include your standard deduction or exemptions. So it's before that.
Before any deduction.
Before your standard deduction, before the exemptions, it's the bottom line on
Big
the
number.
front page of a 1040.
That means nothing. Yeah, I
Um,
know.
But it also has some add backs, like you can't deduct your IRA contribution or whatever.
You can't,
That's the modified portion of it.
without any of that stuff.
So it's your income. It doesn't have your deductions taken out of it.
Yeah. There's a whole list on healthcare.gov, and it's pretty easy to find if you just go to the healthcare.gov site, and the information site is written, and you can go in and just put income or household, and it will help you clarify. There are whole pages, if anybody wants to look at this, I have this with me. But, what's included, the wages, salaries, tips, what's not included, and what comes out. So you really do need to go in and kind of do it item by item, but it's on there that you can look that up.
Yeah, I filled mine out, it told me I should apply for Medicaid, and I don't qualify for Medicaid,
So
My
what
income is
hopefully is
too
gonna
low.
happen is people, as healthcare.gov gets working, is that you'd be able to go through and it would really make determination on whether you're eligible for Medicaid, if children are eligible for CHIP, if you're eligible for the advanced premium tax credits. And we have some handouts when you leave too, with some more information that's a little more tactical about, as you're thinking about 100 to 400%, what does that really mean? And 100 to 250% of the poverty level, where those lines are, what it provides for you in terms of eligibility
Mine
for
came out
cost
to
share reduction.
68%, so I get nothing. And I can't afford insurance, so.
And again, as Kevin referenced, the Affordable Care Act, they were hoping to complement some of the government programs in the assumption that Medicaid would be expanded. And then when it went to the Supreme Court, they upheld the individual mandate. They struck down that the states had to expand. Maine chose not to expand. Yesterday, up at the Maine Public Health Association conference, the fall conference, the folks from Maine Equal Justice Partners, that's a great place for people to let their concerns be known. They're really working on this.
Yeah, that's why I want to know who to contact.
Maine Equal Justice Partners, and I actually have her card with me.
Okay.